Welcome to today's session. Lovely to see so many people on the session this afternoon. My name's Stacey Thompson, joined by my colleague Claire Temple this afternoon. We'll be taking you through the presentation. Also delighted to be joined by Bex, who's a business manager from Conisbrough Group Practice, Daniel, Digital and Transformation Lead from Wandsworth PCN, South West London, and Jitu, who is a digital and transformation consultant. So they're here to share their experiences of digital adoption and answer all of your questions. I'm going to start with a little bit of housekeeping, just to be aware that your videos and microphones have been turned off whilst we go through the presentation this afternoon. If you do have any questions during the session, please put them in the Q&A section. You should see that across your top bar, where others will then be able to upvote any questions that they would like answered as well. And we are recording this session today. If you haven't registered for the session directly, you joined via a link that was shared by somebody else, please do ensure that you've popped your email address and your job title into the chat as well, so that we can make sure that you're invited to the D&T Network if you're not already a member. This is where you can access all the recordings and resources that we'll talk about today. Lastly, we would ask you to please take a few moments at the end today just to give us some feedback. Really important to us and helps to improve the service for everyone. So this is the plan for today's session. We've got lots to fit in, but plenty of time left at the end for questions. And if you do stay until the end, we do have a great offer for you as well. So we're going to start with an introduction to the Digital and Transformation Network, which brings together colleagues to share innovation, promote digital solutions and support sustainable transformation in primary care. So then the main part of today's session will focus on the upcoming requirement for online consultations to be available from 8 a.m. to 6:30 p.m. on weekdays. So we'll cover what this requirement means, practical steps to implement it, and share some tools and templates to support you on that journey. We'll then finish with an interactive Q&A with our expert panel, so please do have your questions ready for that. Just going to start by asking a quick question just as we get going around the subject of the core hour online consultation requirement. So you should see a poll pop up in the middle of your screen now with some options for you. Claire, if you wouldn't mind launching that poll.
Just one moment.
Thank you very much. Yeah, so how ready is your practice or PCN for the core hour online consultations? So are you already switched on and feeling ready for it? Feeling that you've got a little bit of work to do, but will be ready by the 1st of October, or not a chance? Do you really think that you're a long way from where you need to be? I'll just give everybody a few more seconds to pop some answers into that. Looking at the minute, like we've got a bit of a mixture, but most people are feeling like they've still got work to do, but will be ready by that 1st of October date. Okay, so today's session is part of the free webinar offer through the D&T Network. If you're not already a member, you can scan the QR code now that you can see there if you've got your smartphone handy, but you will also be sent automatically an enrolment invitation after the session. Digital and Transformation Network came to life in October last year with an aim to connect everyone across healthcare interested or involved in digital and transformation. So we've currently got just under 900 members now. There's a wealth of information and connections on there, including the resources from today. So from the 1st of October 2025, GP practices in England will be required to keep their online consultation tool open during core hours. So that's 8 a.m. to 6:30 p.m. Monday to Friday. So this is part of the new requirements outlined in the 2025-26 GP contract. The tool must be accessible for non-urgent appointment requests, medication queries and your administrative requests, so things like fit note requests. Requirements not yet in effect but will be implemented in October this year, so it's giving us time now to prepare. NHS England has acknowledged concerns from GPs regarding workload, patient demand and safety. To help address these, safeguards are being discussed. So, for example, using AI or trigger words to prevent inappropriate urgent submissions, practices will not be expected to handle urgent requests via the route, and that there may be mechanisms to pause access when safe working limits have been reached. And NHS England will also be publishing a national patient charter that's outlining what patients can expect from practices, what practices expect from patients in return, and that's intended to support mutual understanding and responsible use of online access. So in terms of next steps, NHS England and the Department of Health are meeting with online consultation providers, the BMA and RCGP. More guidance will be released on that over the coming months to support practices in safe implementation. The BMA have taken the position that if these safeguards aren't in place and the software can't sufficiently separate urgent from non-urgent requests, then this contractual requirement will not come into force. Regardless of these conversations and decisions being made, though, we would suggest that you prepare for the practices for this change. If it does go ahead as planned, obviously you will need to be as ready as possible. Claire.
Fabulous. Thank you very much. So we're just going to, before we go into more detail about the online consultations, just to update you on a detailed survey that we undertook last month. These are the top priorities for digital and transformation leads for the upcoming year, and implementing total triage is a fourth on this list. Now that's going to play a huge role in ensuring that the core hour online consultation contract obligations are met by October, but the practice does not need to implement total triage for this to be possible, but many of the aspects of that will help you. So from the other results that we got, there seems to be a wide and varied plan for the upcoming year, anywhere from vaccination update focuses to creating more PCN hubs with shared systems. And it's been absolutely fantastic reading about the different programs that are happening across the country. And then 58% of our respondees feel that they're being adequately supported in their role. So this leaves us a little bit of wiggle room for connecting via networks such as the D&T Network, for sharing ideas and to bolster that support between each other. So in terms of digital access standards, we're going to talk about the DES because that continues to reinforce the principles of modern general practice access, as well as focusing on the deployment of all aspects of modern general practice access, as well as working to continuously improve patient experience. Now, this goes hand in hand with the GP contract changes. Providing online access during core hours will help with improving patient experiences and reducing pressure. So this change is central to ending the 8 a.m. phone rush by offering fair, convenient alternatives. Patients gain flexible access and practices can triage and respond more efficiently, smoothing the demand across the day. And it's more than just online forms. So digital access includes cloud-based telephony, improved call handling, and a greater proportion of appointments being available for booking online. So we'll look at online consultations and the steps to implementing them. So implementing the core hour online consultations requires careful planning and teamwork. So start by setting up a project team that includes clinical staff, admin teams, and patient representatives. And then speak to your patients through surveys or by arranging some drop-in sessions involving everyone early on helps ensure that different perspectives and priorities are considered. Once you've done that, then map out your current workflows to identify some inefficiencies and areas that you might improve. The as-is process that we talk about later can be really useful for this. Offer a range of access options, including online consultations via the practice website or the NHS app, as well as telephone triage and in-person support. And once you've decided on the approach, communicate clearly with patients. Use posters, website updates, and social media to explain the changes and how patients should use each access route. Make sure that you communicate the expected time frame that each request will be responded to by the practice. Aim to respond within 48 hours of these requests online because they should be non-urgent. And most importantly, ensure that staff receive the training that they need to use the systems effectively and that they feel confident when supporting patients in this. So looking at patients who are digitally excluded and engaging them is an important aspect of inclusive healthcare, and it involves a mix, again, of practical support, communication strategies and partnership work. So involve those digitally excluded patients in shaping the support. You'll uncover barriers that you hadn't thought of, and you'll also build trust through that involvement and relationship. So get involved with your local services, find out what's going on in your local area so that you can help to signpost those patients. And remember that switching your online consultation system on for these requests during core hours does not mean that patients cannot contact you via the alternative routes and they can't get that continuity of care that they need. So while we're doing this, there is going to be a period of change for each of the practices and their patients. There's not the vast number of appointments available online. There are going to be a limited number at some point, and we're going to ask the team to book every patient in once they've been care navigated or triaged, and if they need to be seen. So we're going to be diverting some patients away who may not like it. And we need to remember that it will take time for everybody to adjust, so that's patients and people in the practice. But tell the story of why we need to change and show the opportunities and the benefits for the team and for patients. So you can mitigate this unease by good patient communications, ensuring extra staff are allocated during times that you're going to switch these things on or try it for the first time. And make sure you've got contingency planning, because things are not going to go smoothly. Things never do. So make sure you've got that contingency plan in place for certain scenarios. I'm now going to ask if Bex would like to take us through sort of her planning and preparation that she went through in her practice.
Hi there. Hi. I'm going to talk about our practice, but I'm also going to talk about the practices that I've been in contact with as well, because ours was quite an unusual method of introducing online consultation and total triage. I'm drawing on information that I've gathered from other practices, because I'm also the peer ambassador for South Yorkshire. So I'm in contact with lots of practices and help and try and assist them in getting further along this journey. And I talk nationally with other peer ambassadors as well about what they're doing in their areas. So this is kind of a good old melting pot of don't just do what we did, because every practice, as we know, is very different, but I can draw on some experience too. So we are a total triage practice. And I understand that some people will be on that journey already and are just thinking about how they cope in October, and others are not even started and are possibly feeling a little panic stricken. Fear not. So I would suggest that the best place to start is to gather as much information as you can from the system that you already have. So you'll be talking about what services do you have available to you, and that's both within your practice and externally in your local area. Your care navigators will know that really well, and you should draw on that information, and so you can map out, okay, what things can we even stop flowing through this system? So our care navigators can stop that as soon as it comes through the front door, whether that's digital or in real life. Look at how many appointments that you can offer with the staff that you have on every given day of the week, so that you can see what capacity you have, and also map against that the types and levels of complexity or the types of patients that they can see. So you can see if you've got any little gaps. You might have some days where you think you have a lot of staff in, but all those staff see lower levels of complexity. Or you may have days where you've got lots of highly qualified staff and they see high level things, but you know that at certain periods of the year that you're going to get lots of coughs, colds and sniffles, and you're thinking, well, we could really be doing with lower level clinical staff on those days. So look at that as your capacity across the week. And then, if you can, look at the trends across the week about what is being seen. So, and that is going to vary throughout the year, but think about what is being seen and by whom, so you can see again, do you need to perhaps, excuse me, move staff from certain days of the week to other days of the week? You may need a little bit of negotiating and timetabling there. What times of days are you realistically going to offer appointments, and the types of appointments? So we always look at when we are dealing with a lot of our GPs and high-level clinical work, we often look further later on in the day, because first thing in the morning, they tend to start a little bit later than some of our nurses and HCAs and things, and B, we often see a lot of patients that are at work and would like to come and see us after work. And so you need to look at when are your most useful and most in demand appointments that you have on your clinical system already. Is there any balancing out of the week you need to do? So are you needing to ask people if they can just shift their day a little bit so they could work a bit later and start a bit later, or are you asking somebody that if they could change it one day to another day, because on one day you're particularly highly staffed and another day you're not? You have a look at your gaps. Bear in mind that with experience, and this isn't just our practice, this is what I see across what I've seen across the board, is that when you do use total triage, the quality of their data you'll find is incredible. And you will find, as most people do, that the trend in the week in terms of workload, and it reinforces what we have in our gut feeling, is that it's like what I would say is like a back to front J. We start at the top of the day start at the top of the week on a Monday, highest demand, first thing Monday morning. It's not our imaginations, it really does happen. And then it drops down in the week quite dramatically. Tuesdays are quite busy. Wednesday, we're at the bottom of the curve, and it bumps along a little bit Wednesday, Thursday, and then maybe a little uptick on the Friday as people realise, oh, I need to do something before the weekend about this, or I've been living with this all week and I've got something coming up at the weekend and I want it cured right away. We know those instant resolving problems that everybody wants us to deal with. So use that model, that back to front J, as your basis for your planning, because it happens everywhere and it will happen. And I think even when we have the system and it's open for all our core hours, as we were saying, that is for non-urgents, but it will take time for our patient population to realise they don't have to contact us with that 8 a.m. rush, whatever day of the week it is. So think about the time it's going to take. It's not going to be instant. So don't think, oh, well, we're going to be open all day, so patients can contact us anytime. Their learning process is much slower than ours needs to be. And they will cotton on to the fact that, oh, I tried ringing at 8 o'clock, or I tried going on to the triage at 8 o'clock in the morning and it was much busier. And then realising, you know what, I could contact them at 11 and still get exactly the same service, but it's actually a bit quicker. Decide who in your team is going to do triaging if you're going for the total triage model. So I've seen models where we've had everything from the care navigators through to partners only. And that is going to depend on your setup within your practice. But what you do want to bear in mind is that triaging is quite a nuanced art. And having, for us as a practice, having our care navigators triage is not the most effective way to do it. We find that there are too many patients, complex patients being put in with people that can't handle that level of clinical care, and easier things going in with people that could cope with much more complex care. So think about who you're going to use. I know that some places use AMPs very effectively. Some people have their rotas so that it's all GPs, whether you're partner or salaried, and some people like us have partners only. We decided on the partners only model because we find that that's the best use of their time. We're a training practice, so we have the triaging and the training and the supervision and the debriefing and everything. That is the level at which the partners work within our practice. So think about who's going to triage and make sure that you give them the opportunity to learn and train on the job. And at this point, I've added it to my notes as a kind of the end thing to think about, but actually it's worth mentioning here. Try and see if you can find people locally who are doing this already, and ask if you can go and see and have that person, the people that are going to train to do triage, go and sit in with them. Can they visit the practice and see how they do it, and learn how you might adapt that to your own staff. Whatever platform you use, and there are plenty of platforms out there now, whether it's Accurix or Anima or whatever platform you're going to use for your online consultation. If you're going to go the triage route, try and find somebody. A lot of these organizations will have champions or ambassadors, and they are there to help train other people peer to peer. As a practice, we use Accurix, and we have people come and visit us all the time. I mean, monthly, people are coming and going from other practices in our area to say, how are you doing it? You know, we're thinking about starting, or we're wanting to know how we can get better. And they come and have a look, and we learn from them all the time, and they learn from us. So it's a two-way street. It's a really good method of learning. And those people who actually are doing the triaging find it useful because they can watch somebody else do it and talk through with them their thought processes, etc. So think about that, bear that in mind, reach out to the organisations who are supplying your platform and see if they have ambassadors in your area, if that's something you're interested in doing. Accept that not everybody, even if you decide it's partners only or it's AMPs who are doing your triaging, accept that not everybody is good at it. And that's okay. And it might be okay to say not everybody at that level does the triaging because they are slower, or they're less risk averse, or they are not as efficient, and you finding that you're struggling to get through the actual workload. Maybe they, you know, they don't enjoy it and they find it too stressful. And accept that. And some people really enjoyed that part of their work. And you know, so don't kind of force everybody into the same box. I think it's quite easy to think, well, everybody at this level is going to have to take it in turns. Have discussions about whether that's realistic, and you might want to just try everybody and then see how people perform, whether they need some further training and support, or whether it's just not for them because they don't have that way of thinking or that capacity, or that speed of work, because it can come in quite thick and fast. If you're not doing online consultation or total triage now, not yet, and we know that October will be upon us in no time, my tip would be get on it as soon as you can, even if you are just getting used to it and using that kind of emergency stop button that says we're closing it temporarily. Get used to the actual process, get used to the speed at which things come in, so that you're not totally overwhelmed by the time October comes in and we're being asked to have it open all core hours. So that was my other tip. Then second strand of preparation from my perspective is the patient side. So that was just within practice and the clinical side of it. The other side is inform or warn your patients of what is happening. If you do have an active patient participation group and they are helpful to you, use them. If not, try and contact your wider patient group, you know, patient population, and talk to people about what's going on. Inform them. And I always think back to my previous work before I became a business manager here. And I always think people adopt things much more if you can sell it to them. There's something in it for them. It's not just about us and our lives and what works for us, but what's in it for them, and they will adopt it much faster. So talk about the benefits of convenience, you know, put examples out there. If you're a busy parent and you're always doing the school run at 8 o'clock when the line's open, and by the time you've finished dropping off kids or to daycare or whatever it is, and you're 323 in the queue and you're never going to get an appointment, sell it to them, give a little case study or an example story, and tell them how it's going to benefit them, because they're going to be able to get in contact with you at a time that is convenient for them. Encourage people to use this digital avenue, even if it's to get them to think about freeing up space on telephones or reducing the queue in the practice for those people that can't access the digital pathway. So we also explain to our patients, look, I know you think you're not getting through digitally, but if you can do it digitally, please do, because there are some people who really can't. Either they don't have the physical ability to do it, or they don't have access to the digital technology. They are the ones that need the alternative routes. So sell it to the patient from their perspective rather than why it's going to be better for the practice. And I know some people are thinking, well, is it really going to be better for the practice? But it will be in the long run. Short-term pain for long-term gain, I promise. Give the patients regular updates and bulletins as to your progress so that they know that you're still on that path and it's still moving forward and you're still going to get there and that this is still going to happen. Okay, so if you keep them informed and tell them, well, we're doing this training and we're doing this learning and we're looking at the changes that we need to make in practice. So things might look a little bit differently. It reassures them that A, it wasn't just something you announced once and then, oh, suddenly it's go live day. And B, it reassures them that you're having to make changes and adapt to things as well. So it kind of puts you all in the same boat. Let them know what to expect. If you can put pictures on social media so that they become familiar with what the online consultation forms look like, or pages, where to find the actual information on their website, if that's the access route you're going to be. If you're wanting them to access the online consultation through the NHS app, you know, start pushing that and asking them to download the app and make sure they've got it, and bestow the benefits of doing that as well. So that it all becomes a bit more familiar to them, even if they've only seen the page once before on a social media scroll as they're scrolling through in an evening. That will then suddenly become familiar to them when they you do go live and they have to access it for the first time. So if you give them images of what to expect, it really helps patients. Do a countdown the week before. People will forget, and especially if it's a social media thing, they might miss the page. It might just, you know, they might flick past it and think, oh, I've seen something and I can't find it again. Do a countdown the week before of the days, and keep telling them every day. Do something like each day tell them another benefit to them and why they should do it, so that by day one you'll have people that are actually eager to use it. They'll be wanting to be. There are always people out there that want to be the first to use it or be on the first day of using it. So it kind of encourages that. And then you're not thinking, well, we're switching this on and people are just still ringing through the phone and nobody's using it. It's kind of building that vibe. I'm nearly done, so bear with me. I just had so many notes from so much experience with so many people that I was trying to get through this as quickly as I can. Try and get, if you can, try and getting funding or thinking about funding a standalone, either some people have got iPads or a standalone lockdown PC. You can ask your IT support to lock it down so that somebody in the waiting room who perhaps doesn't have the technology at home can still come in and use the online. They don't have to wait in a queue at the front desk, and they don't have to phone. But if they don't have access to the digital, they have another way of accessing, and they can come in and they don't feel excluded from that, because digital exclusion is quite an issue in the UK, or bigger issue in the UK than we actually imagine. So if you can try and get a lockdown station, as we call them, where people can access it, that makes them feel part of it. And it also allows you, staff members, whether it's your care navigators or receptionists, whatever you like to call them, to actually help people. They might come in and say, well, I do have a laptop at home, or I do have access at home, or I could do it on my phone at home, but I don't know how it works. You can then do a demonstration right there with them. Finally, make sure you are linking your online consultation with the NHS app, because then it ties in with all the national promotions about NHS app, which is being pushed quite hard this year, as we know. It allows people to be able to go to the same place for everything. They're not having to think, oh, I have to save the page, your home page. I can just go there. I know I can ask for an appointment. I can cancel my appointment. I get my test results. I can see my notes after I've been to the doctor, etc. So it all puts it in one place. It's really, really handy. Make sure that your website, this is one where we had to work quite hard with our website provider, make sure your website prioritizes that access link. So what we found was we had the access link put nice and clearly on our front page when we first set up, but then realized if you have, and it was me at the time, had a small old-fashioned smartphone, I actually had to scroll to find that button because the formatting for a smaller screen was different to the big screens. So depending on the device that you're using, make sure that it still remains at the top. So that's why you might need to work with your website provider to make sure that whatever format or size of device you're reading it on, that contact us or book your appointment here or whatever, however you're going to advertise it, is nice top and center. So people are not scrolling for it. If they're having to scroll, they'll give up and revert to their old habits. We know habits are so hard to break. So that's another one. And two final points. One, we said to our staff when we first made the change was, you have all the time in the world on the call. If that means we're investing time now to make things better later, do it. So if that call, somebody's on a phone call and it's the type of person, doesn't matter, and don't be ageist about it or sexist about it or anything else, just say to that person, is this something you think you could do? Do you have access to this information? Because if you can, I'd like to talk you through using the online consultation tool, and get the care navigator or receptionist to talk the patient through while they're on the phone, and then ask them at the end, do you think you'll be able to do that again next time? And we found that was a huge help. People just felt reassured that they were doing it right. They knew what to expect. And we had such a rapid increase of people then using that online tool in the future, because they'd been reassured and had their hand held throughout the process. And I think I'm at the end. So, yes, look out for your ambassadors or champions or whatever you have locally. And if you're unsure, reach out to your ICB and ask who your NHS England peer ambassador is, because they'll likely be able to put you in touch with a practice who is open and willing to take visitors if that's what you'd like to do.
Thank you so much, Bex. So much useful information in there. Thank you. If you've got any questions that you'd like Bex to answer a little bit later, pop them in the Q&A section. But thank you very much for now. We're going to hand over now to Daniel. And Daniel is going to talk us, share how his practice and the PCN that he works with communicated with the patients about the online consultation system. So you've only got about 6 minutes, Daniel, if that's okay.
I'll be quick, thank you. You know, Bex has really hit the nail on the head there. I think patient communication is so important, because especially if the patients are left in the dark, they kind of come up with assumptions like, oh, they're just trying to fob us off without actually speaking to a human, that kind of thing. What we did in Wandsworth PCN, we're all at different stages. So I'm basing it off of Chatfield Medical Centre, which has now switched to total triage. We sent out a text message campaign 1 week prior to it launching, and then the website, we updated that a month before. Let me just share my screen and I can show you what that looks like. So as you can see here, we've put a little clip on the homepage that just explains how we're now working. And then we've got a note here where patients can click on it to get further information. And it also takes you to the triage site. I think the most important thing as well, when patients are trying to request on the phone, is to advise to go to the online form in the first instance. However, if they don't have access to the internet or a smartphone or tablet, then it's important to make the distinguish the receptionist can complete that over the phone or in person at the front desk for them. So even those digitally excluded patients still have that access to care. I think also in terms of demand and capacity planning, it's important to factor in different streams of data rather than just looking in one place, because that won't give you the full picture of everything. So you'd want your appointment reporting data, your AccuRx triage data, etc. Then you can get the full picture. In terms of, did you want me to talk about the clinical safety as well?
Yeah.
Yeah, sure. I know a lot of people have heard about it, but probably not many have it in place, but ensuring your DCB 0160 is completed. Here it's just important to note to also linking with your ICB and neighbouring practices, as they might have already written this up. I know for Wandsworth, the ICB did a transfer of controls document, so we were sorted that way. But it is something that is going to become more of a focus, just to ensure that that is completed for all of the digital tools that you're using.
Fab. Thank you very much, Daniel, and we'll have some questions for you after. And I'll pass it back over to Stacey.
Thank you. Yeah, thanks to Daniel and to Bex as well. Really helpful. So just on the back of that, really, that we've got some templates and tools that we use in our project at Redmore Health when we're working with customers to improve systems and processes. So Claire mentioned it earlier on, we use this as-is matrix to explore some of the common tasks requested by patients, just to help map out current processes. I think Bex sort of mentioned at the beginning of her piece as well, just seeing where you're at now, identify where workflows and entry points could be improved. So from here, practices can then start to form a plan for change. It's always a valuable discussion with the team. Be prepared. I guess disagreements can arise around this. I think that said, and again, Bex mentioned this, it's usually your reception, care navigation, your frontline team who've got the most accurate insight into what's going on here. You'll notice many tasks may still come through via the telephone at the moment. A quick review often reveals opportunities to streamline your processes using your online consultation and other tools, particularly thinking around ordering medication, cancelling appointments, test results, checking vet records via the NHS app. So making things easier for both the practice and patients. Once you've completed this, you can then decide how you're going to improve your services and create that future plan version of this to help update practice processes for the upcoming change. So you can then transfer that information onto a bit of a visual workflow for the practice. So this could be done before as well as after the change. You might find it helpful to create one of these that matches your as-is process and then just make the changes on here. Start small as well. You might want to add administration and medication requests in core hours first and then approach appointments. So this is an example patient journey. Remember that you need to give patients information on how to book appointments online and when they do, tell them, so you can see in the image there, you're giving patients expectations and they understand how long it will take for the practice to respond, what method the practice will use to contact them back, and that they remind as well that they can view certain results and the consultations on the NHS app. So once your workflow's finalised, it's essential to then optimise your appointment book to ensure you've got enough appointments available for requests that can't be navigated elsewhere. A well-structured appointment system helps manage demand effectively, improves your patient access, whether you're using total triage or a more hybrid approach. This still absolutely applies. Start by analysing and identifying your trends. Look at maybe a typical 2-week snapshot of your system and highlight how your appointments are currently being used. Look at the balance between routine and on the day appointments to understand where changes may be needed. Allocate your appointment time appropriately and determine how much time each clinician requires for non-urgent appointments to prevent any bottlenecks and to ensure your patients are seen in a timely manner. Effective appointment allocation does help manage your workload efficiently and supports better patient flow. So there is a demand and capacity tool provided by the NHS through Futures. It's a valuable way to analyse how your appointments are being used and can help you to plan future capacity. The tool will help you to understand how your appointments are handled, whether they're managed via messaging, telephone consultations or face-to-face. The timing of consultation, so identifying the length of appointments. To use the tool, there is a bit of a manual process. You need to input the data from the clinical system manually, and that does require a little bit of effort, but the insights gained can be extremely useful for balancing that demand and capacity effectively. Practices we've worked with, we've done lots of data analysis around this, do find that the demand is really quite predictable overall, similar to what Bex said in terms of the back to front J. There are clear patterns that you can use when you're planning your rotas. Clinical systems also provide value reports that can help you monitor appointment utilisation, your did not attend rates and your appointment usage by mode. So these insights are really helpful for understanding patient demand, clinician workload, and these are examples of reports that are available through both EMIS and System 1. And you can run reports for all types of clinicians, including your additional roles, to see how your workload is distributed. And if you're directing patients to those alternative services, the reports will help you track uptake and to measure the impact that you're finding. Once you've agreed your new appointment book and processes, your appointment policy should be updated and shared. So this should help outline how appointments are created, managed, booked and cancelled within a practice. Share this policy with all of your team members so that everyone's aware, has good understanding, and make sure that you're keeping your patients informed during the process. Use your PPGs as well to help support that. The practice website should be updated to reflect any changes so patients see it there, and make good use of the social media platforms that you've got as well to cascade information, regular posts leading up to and during any change. We at Redmore, we do run a social media managed service as well, so we can help you with increasing reach or getting you started on social media. So do get in touch if that's something that you'd like a little bit more information on. Also include this information in your induction, your new starter packs as well, so that everyone is familiar with these processes. Similarly, your care navigation policy, as part of the contract obligations, update your care navigation policy to reflect any changes made and keep that to hand for staff, and have it in a shared folder for easy access. Thinking about telephone lines as well as part of the changes, make sure your telephony system is updated so that you make sure your call flow is short, efficient, but use your on-hold messages to provide patients with information about alternative ways to book, change and cancel their appointments, such as via the NHS app. Once you've implemented the process, you need to continually review and improve it. So you're not going to get everything right first time, but establish a regular schedule for review to ensure its ongoing effectiveness. Make sure you're celebrating your successes and positive outcomes with practice and patients. And again, as Claire mentioned, join the D&T Network as well. You can get support and advice from other people who are going through the same journey. So I'm just going to hand over to, delighted to be joined by Jitu this afternoon. He's going to take us through a phased implementation of online consultation and how that's worked in practices he's a part of. Hi, Jitu.
Hi, afternoon, everybody. Thanks a lot for having me. Claire, Tracy. I'm just going to touch on, I was just looking at some of the QAs, so thanks a lot to Bex and of course Daniel, that was really very useful. But something that I would like to touch on looking at the Q&As is the background that we come from. Supporting practices have been the ones who do not want to implement total triage, and I think that's been one of the biggest challenges, and especially for some of the organizations, the practices where we predominantly have supported are, let's say, Birmingham, very deprived areas. They're patients who are quite digitally excluded. They're patients who are not very willing, no matter how much we try to engage, as many communications, no matter how many digital open days we've had, trainings, but there is a bit of resistance in there. But how are we trying to involve and keep them within this change and to be able to support the practices? Now, the biggest challenge we have, not I would say challenge, but there are a lot of single-handed practices here. There are a lot of practices who are not 15,000, 18,000, 20,000 practices. There are practices, I'm talking about 1,500 patients. There's practices about 3,000 patients, 4,000 patients, where they probably do not have the capacity internally to be able to deliver something like total triage. And I completely echo some of the questions and the concerns that's been raised on the chat and Q&A. And I would like to say one thing that we've managed to implement and seen some real-time difference in implementing, and a very phased approach was, of course, as part of capacity and access plan in the previous year, there was a requirement, there was an ask that, prior to LMC, BMAs, everyone getting involved, like you need to have simpler online requests. So how do we introduce that? Of course, one of the main focal point was how we're able to shift the patients who are capable to submit some of these requests from over the phone or face-to-face to online. That was the main focus to start with, so that it was a very good, I would say, an exercise, 23-24 for most of the practices who were not very welcoming to implementing the simpler online requests. I always thought of it as a hybrid model. How do we include everyone? We thought, how are we able to shift most of these requests that's coming over the phone, such as your sick notes, access to patient records, your subject access requests, your repeat prescriptions? How are we able to use these trigger words with the patients, with the individuals with the patients, there are regular callers, there are certain patients who are more than capable to actually get them off the phone onto the online platform, as Bex very rightly mentioned about website. Now, that has been a very, very key feature. One thing we tried to avoid while answering phone calls from the patients, and when they were using these trigger words, as I just mentioned, could be administrative, was, can you go to this website? So for instance, if I had to say www.Burberry Medical Center, I'd probably take up about a minute, try to explain or spelling out the website address. What we do, obviously, a quick way of implementing is now you could use whatever online tool that you've used, your AccuRx's, your eConsult, your Animas, whatever it is. We use a normal triage link, and we said, you know what, we're not taking this request over the phone. I'm just going to send you a text. So we were using AccuRx. We said, I'm going to send you a text. Can you just follow that link and submit the request? And we very clearly mentioned it on the text that this link never expires. Okay, just so that they're aware that they don't need to actually go on the website or look anywhere else. They can actually just revisit that message whenever they want, click that link and submit the request. What we truly identified the benefit of that was, okay, the intention was never to reduce our call volumes. The intention was always how many of these individuals who are ringing over the phone for this particular request are never going to ring us again. And they know this is a lot more simpler for them to request via this platform. They don't have to wait on the phone for 5, 6, 7, 8 minutes, be on a call queue for about 30 patients ahead of them. That's where we really started identifying the true benefits, because we then started answering phone calls who could not get in contact with us online. We were able to attend the callers who needed to be attended over the phone or face-to-face. For instance, we had about 10 patients. We did a very small exercise. We started with about 10 to 15 patients a day. We then identified how many of these patients then ring us back in the next 30 days for the same request. We realized about 50% of those 50% of those patients never rang back for about next couple of months, and we had about 3 or 4 different requests coming through to them from the same platform. And that's where we try to analyze where the true benefit lies. We realized also our call wait times reduced significantly because we were able to see through the calls a lot quicker. I would say where our average talk time, we're talking about 1 minute 30 seconds to 1 minute 40 seconds, was way under a minute, because we were able to turn around the calls to say, trigger word, yes, I'm going to send you a text. Can you just follow that link? And it took a while. It took us some time to encourage patients. We had quite a few PPGs. We had quite a few engagement sessions, training days for patients to just walk in and see how the system works, and talking through the patient journey and our journey to the patients to say, what do we actually do with these requests? So this was a phased implementation that we had over capacity and access plan in 24-25. Now, going to the digital adaptation of from 8 till 6:30. Now, this is not for all. This is not total triage that we're talking about. This is what we're talking about is how are you giving patients an alternative route to get in contact with you if they don't want to get in contact with you over the phone or be face-to-face. Now, we're looking at this as an additional route. How you navigate those patients, in my opinion, I feel it shouldn't be any different than how you would if a patient was over the phone or has to be face-to-face. Now, a lot of people think, oh, what if you run out of appointments? What do we do? I feel you shouldn't be doing anything differently than what you did if a patient picked up the phone and spoke to you at about 5 o'clock in the evening, 5:30, or if a patient turned up. It's about how you clearly communicate that message on their submission requests, on their websites, as to what do you do with your urgent requests. Is this supposed to be an urgent? Are you opening this platform or this channel for patients to submit urgent requests? There are going to be a number of practices. There are going to be a number of practices who will be like, no, we want to open. Yes, we are okay to do 8 till 6:30, but we're not really triaging. We don't have a duty doctor. We are a very traditional GP practices where we have a GP come and do a 3-hour surgery in the morning, 3 hour in the evening, and that's how our practice works. And access is not an issue. what we're trying to achieve from it is how are we giving patients an option to be able to submit their request if they are not able to get through to you over the phone. So there is another way, another angle you want to put, you want to approach this. If you don't want to go to the total triage, I feel if you're not comfortable delivering a total triage model, could be your capacity, could be for whatever reasons, probably there's no need for a total triage for the patients that you're serving or the population you're serving. What I would highly recommend is to be able to have that clear message for patients to say, what is a request that is acceptable? What is your turnaround time? Is it 48 hours? Is it a routine request? Is it an admin request? Just to be very explicitly have that communication back and a response back as a submission for you to say, how do you actually navigate that request that comes through to you? Now, this is I'm obviously trying to keep it as brief as I can from my experience. This is, we have realized, has changed the mindset of the way now we have individuals getting in contact with the GP practice. It has no way has it reduced the demand. It's not that we are underutilizing appointments. The demand is just as high as it was previously. Everyone's working tirelessly. But what we've tried to see is we are able to attend to the patients over the phone or face-to-face are the ones who really need to be attended on the same day. And this has been very well accepted within the communities that we've gone and promoted this. And I would highly encourage not to fear the fact that you're opening a floodgate. It is all about how you communicate it, how you're going to manage that demand, how you're going to manage that request. If you have the clear line of communication with the patients that you're going to be, or the practice that is going to be implementing this, it is no way the ask for a total triage. The ask is to make the request a lot more simpler. You're giving them an option between 8 till 6:30 to submit a request. It doesn't need to be urgent. You just need to be an additional route for patients to get in contact with. And how are you promoting this? How are you encouraging them? It's completely up to you. I also seen someone mention about mapping, capping your request. I mean, I've had plenty of practices who feel it's not clinically safe for them to have the clinical requests open throughout the day. If you're able to justify the need of putting a cap or justify the need of suspending the triage for the day at a certain point of time, if you're able to do that clinically, I feel it's absolutely fair to do so. And just one quick thing I would like to mention is how do you reflect the activity that you're doing on your online consultation onto your GPad is quite crucial. You know, just mapping those slots. Not all the online consultation tool have any kind of integration in a way the appointments are getting booked straight into your appointment book. I would highly recommend to have a system in place that you're able to reflect that activity onto your EMIS, on your System 1 or Medicare or whichever new upcoming clinical system suppliers are going to be, is how are you reflecting that activity from your online onto your clinical system for it to be reflected onto your GPad, because you're doing a lot more work than what GPad essentially demonstrates. I would say if you can have a process of being able to pick up those requests from your online consultation tool onto your EMIS. Now there are several ways you could do that, but I would highly recommend to have some form of activity to be recorded onto EMIS. Even if it is a triage request, if there is a GP who's involved at certain point in that triage, I highly recommend that to be mapped as a consultation so that your activity is truly reflected onto GPad. And of course, they do say that it's not a monitoring tool, but it could be a very good evidence for you. That could be a CQC for you to show your how you're managing your demand and what kind of capacity is built that you work towards. That's just my 2 pence, Claire. Stacey, is there anything else you would want me to add?
Thank you very much, Jitu. I'm just aware of time, but you've answered a lot of the questions that were in the Q&A. So what I will do is I've got a quick slide to go to in between the Q&A, which is basically what are you going to do next? So are you going to find a champion to lead your practice or your PCN or your project? Are you going to plan your patient and your staff communications, or are you going to start mapping your process? Do you want to reach out to Redmore Health? So we've got a new triage toolkit that will guide you through the steps to implement online consultations. We can provide tailored hands-on support for you, whether it's one day or over a longer period of time. And we can also attend any PCN meetings or other meetings that might be useful to speak to others in your area. But whatever you decide to do as a next step, I hope this session has provided some clarity. We have got Q&As in a second. Also, just to add that by way of a thank you for attending today, if you contact us by the end of May this year, we'll give you a 10% discount on any of our services. I was just going to pick up that we have also got Mateen who's joined us for the Q&A. I don't know if you've had a look through the Q&A, Mateen, and if there's anything in particular that you feel that you can pick up to answer. Let me just find Mateen.
Good
Are you
afternoon,
there?
everyone.
Hello.
Yeah, I'm here. Hi, nice to be here. Thanks, Claire.
Thank you so much for joining us. Is there anything that you've noticed from the Q&A or from the discussions that you'd quite like to pick up? Because I know we were going to have a Q&A. We don't have a lot of time left, but I'd like to give you some time just to answer some of the queries that have come through. And what we will do is take all of the questions from the Q&A and get answers for you, for everybody, and stick them in the D&T network. But over to you, Mateen.
Yeah, no, thank you so much. I was just going to go briefly talk about obviously Bex has talked about. I'll introduce myself. So I'm a GP partner at the Medical Centre. We believe we ranked #1 in the UK on Google. Just to give you an overview, I've also got roles in PCN, ICP, NHS England advisory groups. I am a tutor at UCL. So my background from regarding this, I just wanted to go through a few of the points. So when we heard about this, 8 o'clock till 6:30, everything that needs to be open. We've been open for the last 2.5 years. And I remember this discussion we had 2.5 years ago when I joined as a partner. How can we enable 24/7 access 365 days a year? And there was a little bit of a pushback. I would classify, I'm just going to take 3 minutes, if you don't mind, just talk through the journey itself. And I think giving a story explains everything really, really well. So I believe we didn't start with tech, we started with tension. When I remember I came in and I said, look, we have to make sure everything open. Patients can contact surgery as how they want, whenever they want, because our vision mission was the growth of NHS Medical Centre. At that first, what I want people to consider when digitally transforming or having any change through my MBA experience is having a framework or a model. And the model we followed is the Cotter's 8-stage model. It's actually a very transformative model, a framework for a manager managing any organizational change. So I'll talk you through it. So the first bit is having an urgency. How are you gonna ask anyone in your organization to have a change unless you provide some substance to why the change should be happening, i.e. providing urgency? So our urgency was the staff were overwhelmed, patients felt frustrated, and everyone was feeling stuck in their reactive mode. There was no proactive care, it was all reactive care. So number 2 step in that model is building a guiding coalition. So instead of waiting to be forced into change, we leaned into it, but we weren't alone. We pulled together a small team of key stakeholders, be it clinicians, be it administrative team, digital teams, who we believe that we could actually improve from where we were currently. The third stage is having a strategic vision. You always need a vision, be it from your practice manager point of view or a GP partner point of view. You need to have a vision in place where you can align all the key stakeholders to be actually wanting to achieve that. So our vision it's not simply about tech here, it's about reducing chaos for staff, and more importantly, putting the patients in the middle. So we had a clear, relatable vision that everyone was aligned to. Then we essentially got all the key stakeholders together. So we communicated the same message every single meeting, in corridors, in WhatsApp threads, in any group meetings, and kept relating the same message clearly so everyone understood it. So we used to start every single meeting by saying, here's what's happening this week, or here's what's going to happen next week. You have to enable, stage number 5 is enabling action by removing barriers. So what were our barriers? The phone queues were, enormous at 8 o'clock in the morning on Mondays, as most surgeries are even currently. We used to waste time chasing information we should have had from the start. So what we started doing is looking for small wins. I think Bex alluded to this earlier as well. So we tested small changes, we gained small wins, and then we celebrated those small wins as well. And I think this really helps. So, for example, our waiting times for queues were around 2 minutes on a Monday morning, but now it's reduced to less than a minute. Average waiting time over a week is 32 seconds currently. So it's not about just having the numbers, we're actually celebrating them. When you have a vision in place, when you have the key stakeholders aligned, you have to celebrate the small wins, so that vision, so everyone pulls in the same direction continuously as well. We shared good feedback. Our Google reviews were going up. Our NHS England's patient survey, which we believe is probably a better reflector, is extremely, extremely high as well. And then how can you sustain the acceleration? So initially people were aligned to it, they wanted to push through it, but you sometimes can get a dip in the enthusiasm of following that through. So we started scaling. We started scaling across different areas in the organization itself. We built in consistent onboarding for new administrative teams, started building SOPs. I think Dan alluded to DC 0160. I think that is key when you're enabling any tech digital change, but that you also need to take into account the DCB 0129, which should give you recommendations on how the DCB 0160 should be formed anyway. We also shared learning across the PCN, adopted some of the wins too there. And I think lastly, institute change. Having a culture in the organization that you are willing to change for the betterment of the practice. And that again comes down to the vision of the practice, which is normally by the key stakeholders in the organization, be it practice managers or mainly the practice partners. So we weren't chasing shiny features, we were embedding what works, looking at equity, making sure digital doesn't leave anyone behind. The biggest lessons I would quickly talk about is it's a culture reset. Start with people in mind, not the shiny technology. Stay focused on the why. Why are you doing this in the first place? And never underestimate the power of small wins, and make sure you celebrate them. Sorry, I took a bit too long.
It's absolutely fine. Thank you very much, Mateen. So we have got quite a few questions in the Q&A, and I know that we have run over time, but it's all been really useful information. So what I will do is I will collate the Q&A questions, and I'll distribute them to our speakers, our panel today, and get some answers for you and share them on the D&T network for everybody to see. And if you also haven't seen the Digital and Transformation Hub, there's more information about that there on our QR code. I want to say a massive thank you to Bex and Daniel and Jitu and Mateen for joining us today. Thank you so much. We will have all of this information on the Digital and Transformation Network.